I'd like to just start off by just giving a little bit of background on really what PCOS is. And there is a little bit of confusion as far as the definition. So we're not going to get too caught up in that. There's several different types of PCOS. And I just want to give a little background on who I am as well. My name is Farrar Duro. I'm a doctor of Oriental medicine. And I struggled with PCOS for many years, really without knowing that I had it. And for me, it was one of those issues where I just kind of went along and didn't really know why my cycle wasn't regular, why I was having unexplained joint pain, sometimes anxiety, depression, and really extremely irregular cycles. And so I learned that over the years that it indeed was PCOS. Um, and when I started out looking at, how do I address this? I was actually in undergraduate school, and I was, really suffering, thinking like, okay, how can I find help? And so I went to several different gynecologists, and I was basically just being told just take birth control and everything will go away. And it seemed like an easy enough solution. So I said, sure, I'll give it a try. I was probably like 17 or 18 years old, and it just made me terribly sick. And I just couldn't get any answers as to what else I could do. So when I started looking into, at that time there really wasn't Google or a lot of, probably going to date myself, but there wasn't a whole lot of information out there of what to do. And I just, at that point said, I'm really fed up. I can't take birth control. I just got really violently ill on it. My body just doesn't agree with it. And I had to find another way. So I actually researched in the medical library, about what we can do to actually help naturally. And I said, maybe I'm just going to look into Chinese medicine. Maybe there's something there that can help me. So I did a research paper on acupuncture and in pre-med actually. And I decided, this is the route that I want to go. Actually, there are some studies that show that it can help me. So I went to school for acupuncture at the age of 19, and I finally got treated. And I actually overcame a lot of those symptoms with just naturally modifying my diet, looking at herbal medicine, and I just made a vow at that point to say, look, this is going to become my life's work, is really help other women who struggle with this find solutions. So that's why I'm here. I do have a private practice in Fort Lauderdale, but I'm very limited as far as reaching all of you that way. So this is why today I'm here to kind of give you more of a background. So, so you can have PCOS without having follicles, a lot of follicles on or cysts per se detected. Some women actually have symptoms, but the ultrasound doesn't really show much. So, but you may have irregular cycles or some symptoms of like high testosterone or abnormal hair growth. Sometimes acne is one of the characteristics. So we look at what type of treatment can we do. And if you are presently, if any of you guys are taking birth control and you're getting relief from all your symptoms, and that is a type of treatment that you can do. And there's, a lot of people who feel better. But the problem is we're actually going to run into some issues when you try to get pregnant. And that's where I work with a lot of women struggling who've maybe been on birth control for like 15 or 20 years to control their symptoms. So after that, there's not a whole lot of treatment of the underlying symptoms sometimes if we're just masking those symptoms with birth control. And believe it or not, a lot of people on birth control for so many years never were told they had PCOS. How many does this sound familiar to anybody? Or so, someone's asking. Yes, there will be a replay. If you guys are in the middle of lunch and have to go, then we'll be sending the replay out. But I encourage you to stay if you can, to ask questions and really get them information. So we're going to go into a lot of details. So, there is basically a big push now to do kind of preventative measures and look at working with not only just weight loss, but really working on a deeper level to work with, hormone balancing in general, because all of them work together like a delicate balance. It takes basically working with, your reproductive hormones, your insulin, and diet, and blood flow, stress levels, all these different components to really get this under control. Um, so, in fact, I mean, we look at the symptoms of anxiety and depression, which is often overlooked with PCOS, and we see that there's just not a whole lot out there as far as treatment goes. And a lot of the counseling focuses on maybe you're depressed because you're gaining weight, or you're depressed because you have acne, but it's sort of a chicken and then the egg scenario. There could be some depression because of a hormonal imbalance too. So, we have to look at not just treating the symptoms, but really getting things under control. So basically, I wanted to focus on certain types of symptoms first that we have that we can actually do something about. If we also treat them early on, it's a little bit better. So when in our office, we do see patients that are as young as maybe 15 years old and have been placed on birth control. Sometimes actually we did have a 12-year-old on birth control just for acne or irregular cycles. And at that point, you can actually see that there's some things that are starting, and we really could be looking at this in a natural perspective. So we first look at, well, what is the reason being on birth control? Is it basically just for symptom relief? Is it for contraception, or is it actually to prevent pain or that sort of thing, cramping and that. So a lot of times we suggest, if you can talk to your doctor, let's see if there's a way we can figure this out by having to take a break from the birth control and really like getting a big handle on those symptoms. So we see that when we start looking at blood work, there's certain things that we look for in somebody who has been diagnosed with PCOS, or maybe they weren't told they have PCOS, they just have irregular cycles. And that's usually one of the big hallmarks. If your cycles are over 35 days, as far as from day one all the way to the next day one of your cycle, then you should kind of like clue into maybe there's something going on here. It could be totally normal, but a lot of times that could be a clue that there's a little bit of a deeper reason. And a lot of times, it's normal just to maybe skip one period a year. That should be okay, but for some people, but a lot of times, our biggest struggle is really figuring out, are you ovulating or not? So in a younger girl, we're really looking at, if you have a daughter maybe with PCOS and you're watching this going, how can I help her without putting her on birth control? Then we really do start with regulating the cycle and just basically working with natural methods. And it could be an herbal treatment, sometimes acupuncture as well. And, I am going to take questions as we go along with this because there's a lot to cover, but I want to actually make sure that we hit on a lot of points that you're bringing up. So if you're trying to get pregnant, a lot of times the whole goal is, I work a lot with fertility. I've been working for 15 years with different IVF clinics as well in my area. And I know that a lot of times the strategy is just with PCOS, let's just continue birth control until you're ready to get pregnant and then get off birth control and then give another, fertility drug to perhaps induce ovulation and then, try to help. So as far as the birth control goes, we like to see patients off birth control for at least 3 to 6 months, and I know that's kind of my my strategy has been, because I want to make sure that those imbalances and those symptoms are actually recognized before getting pregnant. And the reason is this: women with PCOS do have a higher chance of pregnancy complications. There's a higher chance of gestational diabetes. There's also a higher chance of preeclampsia. So all those things, when we look at it from the mom's perspective, from a healthy pregnancy perspective, we want to really address that beforehand. And that there's definitely lots of ways to do that. So, so I would discuss it with your doctor. But if you are, for the person who is asking if they're trying to get pregnant, if they should still take birth control, you know what? It depends on your age also. But I would really just try to give your body a break and see what's going on. And then, if your period doesn't come, we're going to go into today some tips and strategies to actually help that happen naturally. Yay. So I hope that answered your question. And another thing with birth control is there are a few drawbacks to it. It can actually increase insulin resistance. So, that's usually not a good thing. That's why it's given sometimes with metformin or a diabetic drug. But PCOS is a pre-diabetic condition, but it doesn't have to get to that point. So today my goal is to actually go over some strategies, because when we are diagnosed with PCOS, or we think that we could have PCOS, then we need to look at ways to actually prevent some of the conditions that could happen later on in life as well. So I just want to ask if you guys are good. If you guys have, if you don't have to say if you have a PCOS diagnosis, but if you have any family members who have diabetes, or perhaps a sister or an aunt who might have been diagnosed with PCOS. So we find that a lot of times family history is important. There is usually a link, and most of our women with PCOS, they have. I've actually treated a patient whose sister had PCOS, her mom had PCOS, and then her father was diabetic, so she had a lot of that going on in the family. So there's a link there, and what they're really tracing this to a genetic issue as well. So so I think that looking at your family history, that's another clue. Sisters with PCOS, some folks say, "Oh, hi, Mushki, how are you?" Yay! So I think that I'm having my protein shake right now as we talk. But I think that having that, is really a big clue. So we want to, just really look into to that history, and you actually might be able to help them. That's the beauty of this. So, they might have been struggling for years, and then you actually suggest, well, maybe let's just try a few things. Okay, so nobody has. All right, yeah, and what's crazy is I just found out recently my mother had PCOS, and I didn't know it. I actually asked because she had a hysterectomy at 40, and it was from a painful ovarian cyst, but she actually had a PCOS according to, to her history. So PCOS and endometriosis, yes, I'm there with you, and that is just a double whammy, and looking at that, it's difficult. The surgery, when you do have surgery for endometriosis, a lot of times it can help, it can resolve, but then what we see a lot of times is endometriosis coming back, which we don't want. So, so we want to actually kind of create more favorable conditions. So how do we do this? This is really where it comes down to some strategies here, a little bit of strategizing. And I know that a lot of you probably have supplements that you've been using or that you've heard that might work really well. And there are some that are better than others that are out there. So I do sometimes, have people walk in with big trash bags almost full of supplements. So we really want to today give you like the most important supplements that are going to help you. And obviously, if you're taking other medications, you need to check with your primary doctor just to make sure that nothing is interacting. And also if you're on metformin, if you're on any kind of insulin medication or helpful, anything like that, you want to double check, because a lot of times these suggestions are going to actually help regulate your blood sugar, and you might not need as much medication dosage. So I just want to make sure that you are aware of that. So what causes PCOS? We need to really think about that first before we talk about the strategies. And insulin is a hormone that's produced in the pancreas, and that allows your cells to use sugar. So we're not going to get too into the details, but that's your sugar is your primary energy supply. So when you have insulin resistance, you're not using insulin as effectively. So your pancreas has to work really hard to secrete more and more insulin to make that glucose available to your cells, and then the excess insulin affects the ovaries. That in turn, you have increased testosterone production. So testosterone goes up, and that interferes with the ovaries' ability to produce to ovulate. So you have a lot of follicles usually, but they're not mature. So they're kind of just hanging out in the follicle, realm there, but they're not developed. So that in turn is producing that spike in insulin, that insulin resistance, then not being able to get really the nourishment. Producing more testosterone is actually going to increase the symptoms, right? And the symptoms being like sometimes with acne and hair loss, actually, and also abnormal hair growth. It's all really ties into insulin. So yeah, and wow, I just saw the question. Well, we're going to get to that, but that is really that's very interesting, how to prevent children from getting PCOS. So there's actually a new study that came out, and I'm not going to get off the subject, but I'm really passionate about this because I work with a lot of women who are trying to get pregnant, and also who are pregnant. That being exposed to a lot of testosterone, the baby actually being exposed to a lot of testosterone from the mother during pregnancy, it actually can increase risk factors for autism. So I was thinking, wow, that's not good. We need to that's another reason why we need to work with this before pregnancy to really help. So I don't know as far as preventing them from having PCOS, but as far as other complications, we need to get our bodies a little bit healthier first in order to go into that. So, we'll go over some strategies on how you can check for that as well before getting pregnant. You got to find out and do some detective work. So another thing that happens with PCOS is inflammation. And inflammation is just kind of a low-grade inflammation, and it kind of just lingers. And we look at why that's happening. Well, it's basically just it's one of those things with PCOS that from the production of really, really high androgens, it just creates more inflammation in the body. And so when we look at how do we address this, our first strategy is to get a really good high potency omega-3. And not just one that, is a drugstore brand or maybe just has a little bit of DHA with the prenatal. We want something that's pretty potent. So I just have a few things that are part of my regimen that some of you guys might be familiar with. This is actually omega-3, but it's from mussels. So this one actually is called Omaprem. And why I mention it is actually it has a lot of research behind it. So if you look at their website, you're going to see there's an area where you can look and see all the studies they've done on this particular omega. And not only does it help with dysmenorrhea or with cramping, there's actually a study on dysmenorrhea and this particular type of omega, but also helps with inflammatory responses in the body. So it actually has been shown to lower a type of inflammatory marker in the body, which is actually responsible for a lot of destruction and bad stuff. So anyway, this one is one of the good ones that I really recommend. And it's very tiny, and it has, I'm going to take it out here. It doesn't even have a fishy, oh, there it goes. It doesn't even have a fishy smell, which is nice. It's from mussels. So, so that inflammation is really important to get under control, number one, and really importantly. So this is essential. You don't have to get this, but I'd really recommend a high potency omega. And I didn't know this for a while, but a lot of times PCOS produces kind of like achiness, and that's that low grade inflammation a lot of times. That nobody really talks about that, but we see it a lot. Eventually, we have issues with the thyroid as well, And that inflammation causes a lot of times disruptions in all different types of areas, but especially the thyroid. So you see that I'd say the majority of our women that we see with PCOS have a little bit of thyroid imbalance, and so that's really important to check that out as well. It just cascades. So, and the news keeps getting better. So along with that essential omega is really, really good multivitamin. And these are actually, I could send you a link, or I'll post this it's on our website actually, if you want to get it. But this is by Pure Encapsulations. So this is pharmaceutical grade. A lot of the supplements that are out there they don't have a lot of quality control, so we really don't know what we're getting. So this is kind of like the Maserati of multivitamins, you could say. It has about 2,000 IUs of vitamin D. And vitamin D is on our list also of vitamins that can help with regulation of the cycle and inflammation. So this is called 1 multivitamin. It has already the type of folate that everybody can absorb. It's a methylated folate. The 2,000 IUs of vitamin D, and it's got antioxidants in it as well, and a little bit of iodine too to help the thyroid out. So this is really good. It doesn't have iron, so you can take it when you're trying to get pregnant. But once you do get pregnant, we usually switch to a prenatal. So that's what we do in our office too. So along with the multivitamin and that has the built-in vitamin D, or you could actually take vitamin D separately, but that's one of the essentials recommendations. And your omega, we're going to look at, that's basically helping with, regulating ovulation, controlling inflammation. And we're going to look at one thing that has become my go-to most favorite supplement for PCOS that's super easy to do. So how many of you guys are interested in that? Or interested in learning about something easy that doesn't require swallowing a pill? All right. This is actually called myo-inositol. And this actually, the more I learn about it and the more research comes out about it, the more happy I am with it. It's actually in, it's in powder form. So you don't have to swallow any more pills after that. So basically it's a B vitamin derivative. It has a mild sort of sweet taste, but really not much. And you can basically use it in your smoothies, or you can just stir it in, a little bit of water, and it's really good. So what does this stuff do? This is a huge bottle, but it really does. Like if I could give this to everybody and I could just reach across the screen and give all of you it right now, I would. But basically, it does a lot of things. So it opens the cells to actually help get serotonin into the cells better than like a D-chiroinositol, or better than other things. It helps. So it basically helps with insulin resistance. And the dosage usually is 2 grams twice a day. Yes. Yeah. Oh, awesome. Yeah. So some of you are probably already taking it, but maybe you didn't know it also improves irregular cycles. It helps with menstrual pain. It helps with mood swings. And that's when one of the feedback I've heard a lot, as far as the patients that we see, and also myself, is that the difference in the mood is just almost immediate. So I really, I'm a big fan of that. A lot of IVF clinics now are using this to help also with improving response to IVF medications. So, and another thing that this helps with also is if you have someone who, like maybe who's going through some hot flashes or a change of life, it also helps with that as well. So, and the last and final, point that I want to make is that it is safe to use during pregnancy. So you can actually use this, and there's research now that it shows that it prevents neural tube defects. Pretty cool. So that's something that we just say, hey, look, it's good for ovulation. It's good for improving, insulin resistance, balancing glucose, good for your mood. Like, I really just can't think of anything more perfect than that. So good job if you guys are already taking that. And if not, I would check that out. Get a good quality one. Um, so, as far as what else can help with insulin sensitivity, I know that some of you might be taking metformin or glucophage, and for some of you, it's working great. Sometimes, though, it can cause some side effects that are not pleasant, like nausea and just general not feeling good at all. And that takes actually a couple of months sometimes to really to just really accommodate to that. So if, for instance, you're just not, you're thinking about taking an alternative to that, there definitely is, and it's something called berberine. I don't have an example right here, but berberine actually can be used a lot of times in the place of metformin. And so that's one of those things that it's just a lot more research coming out. And yes, and we'll look at that more in detail, but you can actually do a little bit of research on that and see that pure encapsulations, again, the brand told you, they make a really good berberine supplement there. So the last thing I want to mention about supplements is this is actually one I found recent called sleep support. So a lot of you might be having issues with anxiety or insomnia, and so a lot of times we recommend green tea. And green tea is one of the things that it does have a little caffeine, so probably not great for insomnia, but for anxiety, it actually has L-theanine. And that's an ingredient that helps with just mood overall and just, a little bit of a calming effect. So, so I found a spray that has L-theanine in it with no caffeine, melatonin, chamomile, lemon balm, valerian, and it's one of these things where you just do like a few sprays before bed and you're good. So if you're looking for some sleep support, because sleep is so key to this, it's really going to help with hormonal balance and regulation. This is really important. So that's one thing. As far and this is made by Isogenics, so can we'll also send a link for that if you like. But so, that the questions for about supplements. I mean, I don't know if any of you have any burning questions right now. As far as, I mean, I would say that if you're taking also a greens drink, that's important. And then, along with Chinese herbs, we do give a regimen of Chinese herbs to help balance hormones and also help regulate the cycle. So let's say you're coming off birth control, you're trying to get pregnant, and you really want to know, like, I just need to get my cycle back or regulated. There is a formula that's actually in when I studied in China, this is how they use formulas there. They use it in 4 different phases. So as you know, a lot of times, a lot of these formulas are based on a 28-day cycle. So there are certain herbs that are used in China, certain formulas. They're not single herbs. They're actually formulations that are going to help with regulating a cycle and kind of creating a cycle. So you can think of like phase 1, phase 2, phase 3, phase 4. That's what the Blossom formulas do. And they are really, really good for basically just helping like kind of boost that LH surge and helping regulate ovulation and balancing estrogen and progesterone. So those are Chinese herbal formulas that are very, very important as well. So, I mean, is everybody getting some good ideas so far from this? And, we're covering a lot right now, and I don't have a whole lot of time to cover everything I want to cover with you guys, but I want to make sure that you're getting some of your questions answered. Savleen actually asked if there's exercise to share the exercise tips. So a lot of times when I look for an exercise routine, we're going to look at, what's going to help, first of all, with stress levels as well. And so that's going to be different for everybody. A lot of times, it's, the basic recommendations for PCOS are at least, cardio 4 to 5 times a week. And it doesn't have to be really, really strenuous, but they do say to kind of get the heart rate going a little bit, and it could be up to 45 minutes a day. So it's really hard to just start like that if you haven't done any exercise at all. So what I do recommend is actually doing power yoga. And power yoga is something that really gets your heart pumping and also helps with your stress level. And if you can find a power yoga class, it's very important to have that meditation time at the end. You're actually going to get the benefits of the cardiovascular health, muscle toning, and also stress relief as well. And they're finding out so much more about meditation. It doesn't mean that you have to meditate for an hour, but even if you have 10 minutes just laying there in Shavasana, it's just so restorative. And maybe you can't do it every day. Maybe you do it once a week or twice a week, and the other days you go walking. But there are theories that we see sometimes that people just really go all out with CrossFit and a lot of strenuous exercise, and it tends to actually stress them out a little bit more. So I'm from the perspective that you really just need to work with your body and listen to your body. And I don't ever want to force someone to do something that they're really not going to do for the long term. They really just don't, their heart's not in it. So I just get honest with yourself. And even if it's walking your dog, it's a start, and just getting out there and just, or on a treadmill, but make it enjoyable somehow, like get a podcast that you want to listen to, or just start incorporating it. It's going to take a few weeks for your body to actually start craving that type of exercise. But women with PCOS, like, we really need to exercise, not just for our physical well-being, but our mental well-being. And it's really important. So I hope that helps. And I would really look at the Sun Salutation series if you are wanting to try yoga. That, and I have a yoga instructor that we've actually talked back and forth on this many times, and her recommendation is the Sun Salutation A and B, about 10-15 minutes a day when you wake up. It actually incorporates strength training. You've got the mind-body balance and all that. So I hope that helps. Okay. And if you need to know about the Sun Salutations, we actually have posted a video on our on our Facebook page, Florida Complete Wellness, and you can check that out, or ask your teacher as well. Definitely, she'll show you. So I want to kind of get into definitely the diet portion right now, because it's so key with PCOS to really address the nutritional aspect, because we can talk all day long about supplements, but unless we really work with the diet a little bit, then it's just not going to work as effectively. And I want to give you guys some tools that you can use for the long term, not just like fad diet or don't eat this or that. I want to make sure it's doable. So with what we do with my patients in my office, and also women I work with through distance work with PCOS, is we actually create a plan, and we do it based on, there's actually Chinese medicine food therapy, which are targeted foods that really help with strengthening the immune system, regulating the cycle, but also looking at foods that are beneficial as opposed to eliminating so many things from your diet. So we really just start with eliminating a few things and kind of incorporating more things in. So number one is, sugar. We have to find a different solution for sugar, guys. And it might be that it sounds simple, but it's definitely difficult. So many of you probably are using stevia or different types of sweeteners. I do like this liquid one I got from Whole Foods. It's just a stevia extract dropper, and keep it with you in your purse. And when you go out to eat, instead of having sweet tea or dessert with that, you can do a few drops. It just takes 1 or 2 drops of stevia. And also, if you're having some sweet cravings, that's just putting it on the tongue sometimes. It really helps. And it's going to take you probably a few weeks until you really feel that is out of your system, sugar. It's just really addictive, but you will feel so much better, your energy and everything. So, just starting with taking the sugar out of the diet, going into your kitchen. And if you can do that today when you get home from work or you feel like, and just kind of taking that stuff out of your cabinets. And you want to look for things with ingredients that are kind of like your not so good carbohydrates as well, like kind of white foods, we call them, your white breads and all those things. Just taking them out and throwing them out. Nobody else needs them in your family, probably. So if you can, and then, get some stevia or try to just even, do without the sugar a little bit. Just that alone, you're actually going to drop a few pounds, even just right there, just not doing sugar. In fact, what I could say, when I was in China, I studied as a student in Chinese medicine school. When I got there was nothing with sugar. It was crazy. It was like, oh, it was great because I didn't have any temptation around me, and I could actually, eat a ton of food, and I didn't have to worry about gaining weight that much because there was no sugar and there was no dairy. So a lot of times things tasted almost like a stevia type taste. Like it was sweet, but it wasn't like, overtly sweet. So I don't know if you guys experience this, but like, I just feel, like sugar really can affect our moods a lot. And so if you ever have done a sugar detox or just kind of started with that, that's my advice, was just to kind of ease into it. And so by eliminating, the sugar, we look at what else can we do. Is the best thing is to incorporate more fiber, and just looking at eating a little bit more protein in the diet. I just tell people, like, tell our women with PCOS, just eat a little bit of protein with every meal. And even if you're vegetarian, or vegan's a little bit more difficult, but vegetarian, even, we actually have a program now where we actually send you every single day a meal plan based on what our strategy is. So you can incorporate protein. You can have a pretty good diet with being a vegetarian with PCOS. A lot of times people think there's too many carbs, there's no way to do it. You can do it. It's a little easier when you have more choices to select from as far as protein wise, but you have to be able to do the vegetarian diet correctly in order to do it. So with PCOS, it's really important, and you'll probably need a lot of guidance with that, because it's easy to go over your carbs limit there. So you can try just basically incorporating a little bit more protein with every meal, and then watching. You're not going to have to watch your carbs so much if you're thinking about complex carbohydrates with fiber. And the fiber is actually going to help the food actually move a little slower through your digestive tract. Your blood sugar is going to balance out a little bit more. You're going to notice your skin's going to get a little more clear. You're able to go to the bathroom more easily. And when you're incorporating a little bit more protein into your diet, your sleep also improves. So as far as there is so many things out there. Like, there's ketogenic diets, there's keto drinks now, there's just absolutely zero carb or very low carb, low fat, which is not good. So we want to be able to have something that we can actually work with. So I have, over the years, really looked at, we did actually genetic testing, DNA testing with some of our patients as far as to what diet would work the best. With our patients that had PCOS, almost, I'd say actually 100% of them came back as being on a low carb plan. That would be the best for their body genetically. The choices were Mediterranean or paleo, or, a couple other, I think, balanced diet, and then low carb. And low carb every single time came back genetically a match. So I just at that point said, you know what, we're gonna do low carb, and we can do this. It doesn't have to be painful. Another option is having some protein drinks. So this one has about 25 grams of protein, and this is from Isogenics. They do make a vegan one, I believe, as well, with no dairy. It's made of pea and hemp protein. So this one is gluten-free as well. So, there's different options, but if you have trouble getting that protein in and you're in a rush, and just if you can fix a shake for breakfast, or if you're really in a rush, you can have one for dinner, but have that available. So I wonder, with all this information, do you feel like that this is doable? Like, you could probably go out and make some changes tomorrow or tonight, and really incorporate some of these things and get a better hold on your symptoms. And if this is helpful for you, just type it in the chat box and let me know. And I think that for those of you who have maybe you have someone in your life with PCOS, or you're having an issue with maybe your daughter or a loved one, they really need support. And this is one of the crucial things that we emphasize. There's not enough. There's just not enough books in the world, or Google articles, or things out there that actually is going to help, and it doesn't take the place of having a support system. And they've actually done a study recently that came out that showed that actually having a group or support group, and actually having all that support around, actually increased fertility rates for women with PCOS. It also helped with their ovulation rates and so many things. And we've noticed that too with our patients, is that just getting an accountability person, it's so important. So we can just sit here and talk about a lot of information and say this is nice, but until you actually have some accountability and have some support around you, it's just going to be very difficult. And so I have really over the years put together these tidbits. Thank you so much. Caitlin, the doctors keep pushing meds, and they make you sick. I hear you. And I feel like, so I feel like that there's so much to talk about with this, and honestly, there is there's two different types of PCOS. There's definitely a thin type PCOS, where you're not seeing so much of the symptoms, but there's cycle irregularity as well. And the glucose, I'm just going to tell you guys that we didn't go over lab testing, but the glucose might look normal, but the insulin is not. So unless they're checking for your insulin, and usually that's that's really important. They need to actually check for both. That's great. The low carb, high fiber. Glucose alone's not. I've had patients come back normal for glucose. I myself had normal glucose, but my insulin was wacky. So you have to really make sure that both of those are checked. And there are some tests that I can email you guys a list of blood tests that we look for. You can actually give this list to your doctor and say, this is really what I want. I want all this done because you need to demand it. You guys are powerful women. You've dealt with so many things in this, and this is not easy. This is really a lifelong struggle. And so this is why I'm passionate about this. You have to take the bull by the horns with PCOS and say, this is what I need from you, and in a nice way. And that if I don't get this information, I can't make the best choices sometimes about my health. So there is about 10 different parameters in blood work that we look for. And if we don't see those, then we need to order them and make sure that they're there. So I will, if you guys want that, I can get that out to you. And I think I have all your emails here. So it's really important. As far as that, the thin type PCOS, you still have PCOS. It's really, even, nobody needs to actually have a ton of carbs with PCOS. It's just not good for either type. So now if you have the other type where you have a lot of weight to lose, there is going to be, we do have a strategy with our patients to do a little bit stricter weight loss in the beginning. It's a little stricter plan. It is going towards the ketogenic diet, just not forever, but enough, to get some results there. Because we know that just decreasing, even like they say, like 5 to 10% of your weight, it will help you ovulate. It will help you regulate your hormones. But we want to strive for a way you can manage this lifelong. So I want to just let you guys know that I am here for you for support. And if there's anything I can stress, it's basically looking at helping with, hormonal balance. And just working with getting that protein in every single meal. And you're going to feel so much better. And this goes for during pregnancy as well. And then looking at your supplement routine, making sure that you have good quality supplements. I'm not putting any companies down, but there are some independent, research labs, and they do have guides that will tell you if your vitamins are actually being absorbed, if they're bioavailable, and they rate it from a scale of 1 to 5. 1 star to 5 stars. A lot of times these drugstore brands get about half a star. So just be careful what you're putting in your body as well. Gluten can be irritating. The more you follow a high fiber, low carb diet, you're going to get less and less of naturally. You're going to get less that gluten. And I think that, it's just because of the inflammation in our bodies. We have to be careful. No, I will tell you that the good news is with PCOS, as you get older, some of these symptoms like high testosterone are going to even out. So you're not going to have, a lot of times when we look at menopause, perimenopausal type stages in our life, where a lot of women are suffering because their testosterone is really low, we actually have an advantage. Ours are, already high. So a lot of times, so it's actually going to even out, and we'll start to actually feel a little better. But I don't know about you, but I don't want to wait till I'm 45 to start feeling better, or 50. We want to feel better now. So, and this is the thing that I want to stress the most, is we don't have forever, guys. This is actually a short period of time that we have right now to really, it's during our most fertile years, is when PCOS is the worst. So we need to actually, I think, get control of it, and take advantage of it. The time is really now, and take control. And I will tell you a story that we had with one of our patients who was basically told she would never get pregnant on her own. She had a lot of acne, so she was put on Accutane, and they also told her to get to take birth control. And then when she came off birth control, they said, "Oh, you're going to have to do fertility medication, or definitely IVF. You're not ever going to be able to conceive on your own." So what we did in her case, she decided she wanted to do a natural approach. We actually went ahead and she got off birth control. She stopped doing Accutane. She was very terrified about getting off of the birth control because of the acne, because it was controlling it a little bit. When she got off it, she was afraid her face would just flare up, and also she would never see her period again. So when we're on birth control, we have a bleed, but it's not actually a real period, right? It's just an anovulatory bleed. So she had never really experienced a real period. And so really what we did in that case was we started a regimen of Chinese herbal medicine. She did start acupuncture, and I didn't talk a lot about that, but with PCOS, if you do go to an acupuncturist, you can look at, doing different strategies, but a lot of times electroacupuncture is very helpful with PCOS. So we did that, and along with regular acupuncture. And we had her chart. She charted her temperatures. And that's very old school. I know a lot of people think it's kind of, there's so many other things out there and gadgets and, things there. But just plotting your temperature in the morning, if you don't have a regular cycle, it can be a little frustrating at first, but it can help you a lot with figuring out if you're ovulating at all. So we actually, we go into detail about this when I work with women one-on-one, and also in a group environment about this. We've started to really look into, that is kind of like a report card. So in her case, she charted her temperatures on a paper chart, which I really recommend. I know it's old school too, but the apps can get confusing, and sometimes I don't even know if they're correct. But just charting your temperatures on a piece of paper. So she actually had her 2 charts basically that spanned 2 months. She ovulated on a day 47, I believe, and she became pregnant. And it wasn't, but it was maybe 2 months of when she really started working with Chinese herbs and the supplements, and just getting her diet straight and all that. So not only did she get pregnant once, she actually ended up having 4 children naturally. So I'll just tell you, it's completely possible. If you think that, sometimes you feel a little hopeless, like your cycle's never going to come, or it's not going to happen. The beauty of that was that we knew she was pregnant because we could see her temperatures. They were very high for over 18 days after she had a big dip, which meant she ovulated. So, that's really encouraging. And I hope that, that mean, there's so many stories. I could sit here for hours and just tell you guys some really hopeful things. Myself, I just, I took Chinese herbs. I actually went to China. I got on an herbal protocol and came back and really tried to work on regulating my cycles. I had about 40 to 50-day cycles, or times where I didn't see a cycle for several months. So working with herbs, I also did acupuncture as well, and then and have 2 children now. And took a lot of omegas and supplements. So we can definitely beat this. It's something that I'm really passionate about. So I hope that helps you guys. Our basic, really absolutes, I think, with this, or just getting stress under control, eliminating also some toxic influences in your life that might be causing you more stress, letting some of those situations or people go. Working on adrenal support, which means getting enough rest, taking care of yourself, and allowing time for some self-care. Encouraging, just natural hormonal balance by cleaning up the diet a bit, and getting in some exercise. And in the long run, and this is something that we can do. And I really hope that I will be following up with you guys with an email just to get some feedback about any questions you have. But I really hope that this helped. And I want to open it up for some questions if anybody has any questions right now. That I think that I answered some of this. Yeah. About a low carb, high fat. Yes. Okay. Yeah. And yeah. And then you know what? You are in control. If you feel that you're being pressured to do something, like as far as medication wise or that sort of thing, I mean, this is your body. You're going to be the one actually living with all the symptoms and also trying to really gain control of this. So I want you just to have those tools. I am putting together an online program as well that is going to incorporate group support. And I am going to be, I do have a few one-on-one sessions this week. I'm sorry, going into next week, that for basically offering a little bit of strategy too. So if you're interested in a strategy session with me, you can just, hit reply when I do send the emails out, or you can actually let me know here. But looking at the big picture, I think that it's important to equip you guys with some, daily menus or different plans that you can have that you can work with for your life. And I think that, also a lab plan. As far as the risk of PCOS increasing your risk of endometriosis, I really think things go hand in hand. I know that there hasn't been a direct link, but we do see it a lot where, in my experience, using natural progesterone cream, it tends to help balance the odds. We do see a lot of estrogen dominance when we test through saliva, that sort of thing. So if you look at it, that way, I think that it's really important just to make sure that you're getting tested as far as ratios as well with circulating. So sometimes things that are good for the endometriosis are also good for hormonal balance with PCOS as well. And there's also another technique that we use called Mayan abdominal therapy. It's very important for blood flow and also helping with the pain from endometriosis. And what's scary to me is that we're seeing girls younger and younger coming in with endometriosis symptoms. So, I think it's just, I'm not surprised now when I see someone who's, 13, 14, who's just really suffering. So we got to think of a plan. And we can't keep exposing girls to estrogen for 30, 40 years. I just don't think it's good in the long run. So I hope that answered your questions, and I really enjoyed this time with you. And let me know if there's anything else that was on your mind that you had a question about, and we're gonna wrap up in a few minutes. So Caitlin has a question about techniques and supplements with endometriosis. There's, I could probably talk about endometriosis for another hour, but but there's many ways to help with that. And I do find that, using a lot of the same strategies with the diet and omega-3s, and really incorporating those for the anti-inflammatory properties, and then mind abdominal therapy. It's called Arvigo mind abdominal therapy. Great, thank you. And then looking at acupuncture as well, where you look at, checking the hormone levels. With endometriosis, it is an autoimmune condition. Definitely, it can go hand in hand with other things as well. So if you're trying to get pregnant, there's many different, techniques out there to help with reducing inflammation, helping with pain. But I find that Chinese herbs, there's a certain formulas and they're incredible that deal with really helping remove those endometrial implants, or kind of dissolving them from the inside and changing the cycle completely. So, hope that helped you guys. And I really appreciate you staying on with me. If you are, interested in kind of reaching out to anybody else, I'd love to help as many people as we can. Then you will be getting a replay tomorrow, and feel free to forward that to them. And I look forward to connecting with you guys in the future. So have a great day, and thank you so much. Okay.